Please come down. You're able to see if you're there. Okay. Why don't you have this side? Front bench. So attendance of data is better than feedback. No? Yes. Any exercise for you to wake you up? Recently, so one of my colleagues was talking about a teacher who started her class. She asked everybody, I believe, do you like Tony?
Tony?
Maybe has a doctor named Tony? No? No? Tony? No. No? Don't like Tony? Don't like Tony? Just get up. Nobody likes Tony? Huh? Who is Tony? See, when you don't know who is Tony, why can't it be what is Tony? No? Just touch your toe, me. Tony, just touch. Toe me. Yeah? You can reach, no? Yeah? Toe me. Yes? Sit down, don't sleep. Okay, I'm just taking, including you people into a bit of educational research. Okay, this is just a simple study, a project which I just want to do for our me and Kavita doing fellowship in medical education. Okay, there's something interesting to make you or to make learning enjoyable, I should say. Okay, I just engage you for half an hour. Fine. Yes. Maybe it's a non-topic or a non-topic thought, not thought, and not just bothered. Okay. Yes, very good. Grapes? Yes. What answer can I get from you? Grapes. Green grapes. Hey, you're colorblind if you say that's black. Yes? Very good. Bunch of grapes. What type of grapes? What type of grapes? Seedless. Anything? Any adjective say type of grapes? Sun? No. Okay, bunch of grapes. Okay. When you just see this, okay, relate this to your academic experience. Hydatidiform wall. Okay, hydatidiform wall. Yeah, when academic experience will say, when you look at this, you relate it to hydatidiform wall. What is this called in Kannada, Gudna? No, hydatidiform wall like this in Kannada. Then they call this Raksha Garbha. Garbha is uterus, pregnancy. It's entire, you don't see any features, okay? So the entire placenta will be converted into a bunch of grapes. So people call it as Raksha Garbha. Why? They know woman is pregnant by amenorrhea. But when they look at the uterus, there's no features. They saw some structures which look like grapes. Call it as Raksha Garbha. Similarly, you can tell in your languages too. Okay, this is a bunch of grapes. Resemblance? Do they resemble? Yeah, what is this? How are we seeing this? Yeah, what is this picture? What is that picture? Yeah? Have you seen this? Seen this? Does it resemble? Does it resemble this picture? Yes. So macroscope. structures. So bunch of grapes. Why do we say this looks like bunch of grapes? What did you see in a bunch of grapes there? Grapes which are held together. No, they are not individual grapes. They are all held together by straw. Okay then. So that even here, the villi which are transformed into cystic structures, they are all held together by connective tissue. Not because I dissected and cleaned them and then mounted them, maybe few are separate. Otherwise, all these villi are held together by the connective tissue. So that is the bunch of grapes appearance. Quickly go through the information about Hydatidiform mold. Yeah. Shall we just quickly go through? So where do we put this disease? It belongs to a group of diseases which is referred to as gestational trophoblastic diseases. Gestational trophoblastic diseases. So this 30 minutes session I told you, the objectives are at the end of this session, you should be able to define what is gestational trophoblastic disease or what are gestational trophoblastic diseases. Then know the diseases included under. So definition of gestational trophoblastic disease, which are the diseases included under this, and then the definition, types, etiology and pathology of Hydatidiform mold. Anybody who can define what is gestational trophoblastic disease? It constitutes a spectrum of tumours and tumor-like lesions. You know WHO classification when you see, it classifies tumours as, though it is classification of tumor, it's classified as benign, borderline, malignant, tumor-like. So benign, malignant, two extremes. So in between what do you find? Borderline. And then there are some conditions to tumor-like. So gestational trophoblastic disease constitutes a spectrum of tumours and tumor-like conditions characterized by proliferation of placental tissue. Okay, what does a placenta contain? You know that it has villi, and villi are lined by trophoblastic tissue. What are the two types of cells in trophoblastic tissue?
Cytotrophoblast and
very good. Cytotrophoblast and syncytiotrophoblasts. So I repeat the definition here. Gestational trophoblastic disease constitutes spectrum of tumor and tumor-like lesions characterized by proliferation of placental tissue, either villous or trophoblastic. So it is a special disease. Why is it so special? Can anyone read these four? Can you read the four special features?
It's very sensitive to cytotoxic.
Can you hear him? It is very sensitive to cytotoxic drugs. That means curable. Okay. If we go to malignancy, condition which is curable malignancy. Yeah.
Presence of viable trophoblast is associated with high HCG secretion.
Presence of viable trophoblast, which is associated with high HCG secretion. High HCG secretion. So what is HCG called as now here? It is a, does it help us in identifying the disease? Diagnosing?
yes.
So we call this as tumor marker. It's a tumor marker. Okay, this is associated with secretion of HCG. So if you suspect, you can estimate HCG either in serum or urine. Third,
Trophoblastic tumors tissue is genetically mixed, represents both
yeah,
father
this is the question. When there is a tumor, they say, does it belong to the mother, fetus, or the father? Well, this is a big question. I remember many of the examiners used to ask students. So it has genetically mixed component, so represents both father and mother. Yes, a fetus has both genetic constitution of both parents. Then spontaneous regression. So nice, no? So a malignant tumor which is there, which can spontaneously regress. So gestational trophoblastic diseases, what do they include? Tumours and tumor-like lesion. Benign and malignant. And borderline. All are there. Benign, borderline, malignant. All are included. Thank you. So, what are the diseases included under this? Pooja, just read this. Hydatidiform mole. Invasive mole. Choriocarcinoma. Placental site trophoblastic tumor. Can anybody repeat this? Thank you, Pooja. Can you just read it again? Hydatidiform mole. Invasive mole. Choriocarcinoma. Placental site trophoblastic tumor. Hydatidiform mole is placed down. Benign. Choriocarcinoma is frankly malignant. So what is there in between? Invasive mole. And there is another entity which is placental site trophoblastic tumor. It's also a benign entity. Am I going fast? I'm just giving you very few points, okay? Important. Under the must know category. Hydatidiform mole. No, this was a question I remember many students used to ask. What is the meaning of hydatidiform mole? We know that many of the terminologies that we use in pathology are Greek and Latin. When we don't know something, we say, oh, it's Greek and Latin. But it is Greek and Latin. Hydatidiform mole. You know, you've heard of the term mole? A common man uses this term mole to why? Yeah? Why? Mole. If you just say mole to a common man, what does he understand? Birthmark, a pigmented structure or a nodule, elevated or pigmented area, needles, you know, what we say. That is a usual concept everybody has. But just why are we using it here? See, the term mole means it's a Latin terminology. It means a shapeless mass. Mole here is a shapeless mass. So hydatidiform mole, though it looks like a bunch of grapes, the mass on the whole appears shapeless. You can't say it is well circumscribed, it is oval, it is round or anything. Then hydatidiform mole. Hydatidiform is a Greek terminology. Hydatid. Anywhere else we have used this term hydatid? They are all in final term. They are learning the micro. Very good. Hydatid cyst means what? Hydatid. Whenever we use this HYDA, it means it's water. Okay, hydatid cyst, do you remember? If you have not seen the Dr. cyst, please visit our museum and see. So they also look like this. That means it's a vesicle which is filled with fluid which is like water. So is it transudate or exudate that is present in these? Yeah? Transudate or exudate? Transudate. Transudate is like water. Exudate is purulent, fast, opaque, thick. Okay, with more cells and all that. So mole means a shapeless mass. Hydatidiform means a drop of water or a vesicle of water. Remember the first picture I showed you after looking at the grapes? It looked like bunch of grapes, vesicles. So clear. Where do you see this? Something, you know, you do a test to establish that the fluid present in a sac is translucent. What is the test you do in surgery? For translucent, yeah? For hydrocele, you've seen hydrocele? Hydrocele? Transillumination. It just allows the light to pass through. It is a clear fluid transudate. If it gets infected, it becomes exudate. Okay, so the grape-like structures, remember the first one? So you could see there are things called structures with water. So Hydatidiform mole. So remember that picture? It is characterized histologically by cystic swelling of chorionic villi. Do you all remember? Did you see a histology of chorionic villi in first year? Chorionic villi, placenta was shown? Yes. So, in contrast to the placenta, you will see chorionic villi. Here the chorionic villi are swollen, edematous. They are cystically dilated. And the lining what you saw in a normal trophoblast, row of cytotrophoblast and syncytial, here they proliferate. You see, proliferation of trophoblastic cells. So why should we know about this? It's common in India, where the status, socio-economic status is low. That leads to deficiencies, either iron deficiency or folate. Don't say exact pathogenesis or reason is not known, but it is more common in low socio-economic state. So reason is it is associated with an increased risk of persistent trophoblastic disease. So once you diagnose a patient with Hydatidiform mole, so we need to follow up the patient because there is always a chance with this patient to develop invasive mole or she can develop choriocarcinoma. Yes. Anybody who can tell me about this picture? Yes, Bhuvana? What are these? They're chorionic villi. What is this? Chorionic villus. See, the same magnification, two pictures. So low power we are seeing so many villi here, whereas in low power we are able to see only one. So what's happening to the size of the villus here? Sit down please. It is increased. So it's occupying the entire one low power field. Then what else can you make out here? There are some cells here which are proliferated. And what else? This stroma has many cells, but here it is appearing clear. That means it is showing hydropic change. Remember hydropic change? First year, third term general pathology. So there is cystic enlargement, so degeneration of the stroma of the villus, degeneration stroma of the villus. So this is normal trophoblastic tissue, this is Hydatidiform mole. Is there any difference between the two now? Which is normal trophoblastic tissue, which is Hydatidiform mole? Left is normal. Why do you say left is normal? So we took two criteria to diagnose Hydatidiform mole. One is the villi are distended, cystically dilated. So they contain degenerated stroma. And important another feature is, it is not just cystic degenerated villi, they have to be accompanied by trophoblastic proliferation. Normally you see one layer of trophoblast, cytotrophoblast and then syncytial. But in Hydatidiform mole, to make a diagnosis of Hydatidiform mole, important feature is trophoblastic proliferation. So can you make out this is the degenerated stroma of the villus? You can see that it is lined by one or two layers, but it is accompanied by so much of proliferated trophoblast. The moment you look at this trophoblast, it looks so angry, right? It's like hyperchromatic nucleus and all that. So that's how it looks. You should never make a diagnosis of choriocarcinoma when villi are there. Whereas here you can see villi, plenty of villi, they all have vascular stroma. See, their stroma is normal. They all have vascularized stroma. You can see even blood within the channels, vascular channels. So here there are edematous. And there is proliferation of trophoblastic tissue which is not seen in the normal trophoblast of the placenta. So two important criteria to make a diagnosis of Hydatidiform mole histologically: cystically dilated villi, degeneration of the stroma, then proliferation of trophoblasts. Very good. Yes. So when we talk about Hydatidiform mole, again they are subdivided into complete mole, partial mole, invasive mole. So complete mole, partial mole, invasive mole. So invasive mole is also called as chorioadenoma destruens. Sometimes this is appeared as a short topic. Undergraduates wonder what is this. So chorioadenoma destruens is invasive mole. So molar tissue which is in the uterus, it just invades. So if it invades, where does it go? Into the endometrium, myometrium. It just burrows, it just invades into the myometrium. So we call this as locally invasive. Any other tumor you can tell me which is locally invasive? Locally invasive tumors?
Fibroids.
Yeah? Fibroadenoma is locally benign tumor. Adenomyosis is not a tumor. Any other tumor? You compare it with something that burrows. Yeah, what is it? Basal cell carcinoma is locally malignant. Basal cell carcinoma. Where do you see basal cell carcinoma? Which is the most common site? Above the line joining and in the mouth to the tragus of the ear. So locally malignant, you can talk about chorioadenoma destruens also, and then basal cell carcinoma, which is also called as rodent ulcer. Okay, this we described. I just want to give you the names of Hydatidiform mole. See, it's called also as complete mole. Okay, then it's called as a vesicular mole, or it's called as classic mole. It's got how many names in this one? How many? 4, yeah. It's Hydatidiform mole, vesicular mole, complete mole, or classic mole. Yes. Okay. This is repetition of the definition. Now we know Hydatidiform mole is an abnormality of what? Placenta. Placental abnormality. So what is the abnormality? The placenta, the villi are characterized by edema. So there are edematous villi, avascular enlargement of chorionic villi. You saw that in the diagram. Avascular. The omen showed so many vessels with blood. This is avascular enlargement. Trophoblastic proliferation. Then absence of an intact embryo associated with pathological ovum. Absence of an intact embryo. So when this happens, there is no fetus or no fetal parts. So that indirectly tells you what is a complete mole. Complete mole is one where the entire trophoblastic tissue is converted into grape-like structures. There are no fetal parts. No fetal parts at all. So this is associated with pathologic ovum. Okay, this concepts are clear now? Anybody has seen this a case of Hydatidiform mole? No? One posting of OBG is over? No, not seen? No? Okay. So what is the age? See, extremes of age. This can occur in teenagers and people who conceive at a very late age. So what do we call this? When you see some tumors occurring at young age as well as at the old age. Very good. Bimodal age incidence. Can you just give me another example for tumors with bimodal? Yeah?
Leukemia.
Leukemia, very good.
Thyroid.
Any other thyroid? Which lesion? Which lesion of thyroid? Papillary carcinoma of thyroid. When we see it in young age, we do see it in elderly age. Any other tumor related to the lymph node? Primary? What are primary lymph node tumors? Yeah? Lymphoma. Any specific, how do we classify lymphoma? Hodgkin's, non-Hodgkin's. So which has bimodal age incidence? Hodgkin's. Hodgkin's is one. Which has bimodal age incidence. Okay. Then, so incidence of Hydatidiform mole varies, but I think we should be interested in our statistics. So this is about, so 160 to 200 pregnancies. Indonesia, they say it is 100 pregnancy. So there's definitely some cost associated here. So that is what I said. So probably with our country being a developing country, no, it is not underdeveloped. So we are developing. Still, we see this people who are in low socioeconomic status, deficiencies. Probably it is iron or folic acid or the deficiency which adds to it. So when you talk about folic acid deficiency, can you tell me which are the diseases that come to your mind? Very good. Megaloblastic anemia. Then? No. Pernicious anemia is intrinsic factor. Megaloblastic anemia, agreed. Then? Medical students. Very good. Neural tube defects. Then? You know, folic acid is a supplement now which is given to elderly individuals as well. Peripheral? No, that is, you are relating it to megaloblastic anemia. Anything else? We say a supplement of folic acid which has to be given to elderly also. Thrombosis. Will you list? Next class, will you tell me? This is, if somebody, a common man asks you, you should know all this. Books do not teach. You should read and learn about all this. So folic acid. So what is the advantage of giving folic acid? I remember, I think America, somewhere they did a survey, telephonic survey on all teenagers about the use of folic acid. Who has to take and when it has to be taken? All of you need to be supplemented. Do you take? No. You say, oh, still good. Not but still good, I say. No, women in reproductive age group. You should not be supplemented. And especially we say, when a married woman becomes pregnant, when does she go to a gynecologist or obstetrician? It's only when she has amenorrhea. Then they start her on folic acid. No. You should be educating the society or at least the girls in the community to take folic acid. Those who are in the reproductive age group, those who are going to be married, those who are planning for pregnancy, all that, it should start. You should maintain that particular level. If you know what is the level of folic acid in the serum folate level, that should be maintained at any time. So not after conceiving and 1 month or 2 months, embryo development, everything would have happened. So folic acid, you should give me the reasons for folic acid supplementation. So how important it is. This is one here. Clinical features. So we have seen many patients. Usually they complain of vaginal bleeding. So it's a threat. It's a possible concern. A lady with amenorrhea complaining of vaginal bleeding. So when she comes to the obstetrician, on history she says not just bleeding, history of passing grape-like structures. The patient herself says history of passing grape-like structures. Then when you examine height of the uterus, it does not correlate with the LMP. So it could appear bulky and fetal parts cannot be felt. This is when in the past most of the patients used to come in the 4th and 5th month. Now there is higher recognition rate of this disease at a very early stage because now we know early pregnancy, there's a ultrasound done. So you can pick all these abnormalities at a very early stage. So this is when patients used to come to the doctor at 4th or 5th month. So now by 20 weeks an anomaly scan would have been done. So even an earlier scan would pick up the absence of fetal parts. So it is so easy. I don't think a laboratory investigation is required because the ultrasonologist, the radiologist himself says there are no fetal parts and it is hydatidiform mole. So what is the pathogenesis? Pathogenesis and true nature is poorly understood, but cytogenetic studies, when you do a karyotyping, where is karyotyping done? Cytogenetic analysis done in Davangere? You know it? Yeah? No? Okay, we have a well-established genetics laboratory in the Department of Anatomy. Dr. Shailaja is looking after it. Just go have a look at the karyotyping. No different chromosomes, abnormalities. No, ours is a center which is quite well established for cytogenetic studies. So chromosomal constitution of most of the moles is 90%. If you just take this chorionic villus. You know what chorionic villus sampling? You ever heard of it? So that is taken for culture and chromosomal analysis and other genetic studies. So when this is done, most of these villi hydatidiform mole, so they show a constitution, chromosomal constitution of 46 XX. That means 46 XX is female, right? But see, the interesting thing is all these 46 XX. If it's a female child, how does female child get this 46 XX? 23 eggs from mother. Another 23 eggs from father. Okay. Speciality here is, see, all the chromosomes are derived from the sperm. That is paternal origin. So what is the contribution by the mother? Ovum. 0. Ovum is not contributing at all. So this is called as theory of androgenesis. Theory of androgenesis. So entire chromosomes of hydatidiform mole are of paternal origin. So this is how it happens is there is a blighted ovum. Blighted ovum. What is a blighted ovum? Ovum which does not have any genetic constitution, nothing. No chromosomal component. It is as good as a dead ovum, not contributing to anything. So if such blighted ovum gets fertilized by a sperm, no fetal parts develop, fetus cannot develop, so it's only the trophoblast that is formed which gets converted into this abnormal pattern. So theory of androgenesis, the cell development occurs under the direction of the nucleus of the sperm. You just look at this, it's so interesting. Can you understand this? Confusion, right? Who will just look into everything? You just look at this. Can anybody just go and draw a diagram there? Can I choose one of you, please come? Go there, go. This is a chain of reaction, no? You look at somebody, then just look at the person goes in the back. Go there. Yeah. Take the chalk. Write an ovum there. Just a round circle. Okay? Ovum. So 0. Just write 0. No, inside. Otherwise, usually we say 23 eggs. Always 23 eggs, right? Ovum is always 23 eggs. Okay. Now write a sperm. Sperm hitting the ovum. Oh, it's still going near the ovum. It is not. Make it bigger. Let it just collide with this ovum there. Very good. Yeah. So we call this as a sperm with 23 eggs. Yes, 23 eggs. Okay, can you see what is written? Okay. So what happens now? 23 and 0. It just results in 23x only. 23x. Just write an arrow and 23x. But what happens? So this undergoes endo-reduplication. So 23x reduplicates. So another 23x. Next one. So you can just go and read about what is endo-reduplication and all that. Just telling you the basic genetics you would have read in second PUC, I think. Okay, 23x plus 23x. So what does it result in? 46xx. So where did this another 23x come from? It's just the endo-reduplication of the chromosomal constituent of the sperm. This is one way. Thank you. Clear? 23x. Who would volunteer for another mechanism? How else we can get? Is 90% of the Hydatidiform hormones have a composition of 46xx. Anybody from the first bench? Go fast. No? Go ahead, tell you. First step is say, yes, blighted ovum, fine. Now, any other mechanism, can it get fertilized by two sperms? Yes. So what should be the chromosomal constituent of two sperms? Both 23x 23. So write same diagram, write two sperms. 1, 2. 23x, 23x. Okay. Next, what happens now? Second stage itself, we are seeing 46xx. This is one mechanism. Any other mechanism? Third mechanism, can you just think of an abnormality in the sperm itself? Excellent. What do you call that as? Non-disjunction. Second meiotic division, non-disjunction. Okay, sperm itself is abnormal. Come back. Very good. So I want some other person volunteering. No scope for volunteering in the class, right? Only for the programs you need to be volunteers. Somebody, fast. Someone in the last bench, come. Pooja's turn is over. Come, just come. You heard what we discussed? So third possibility you are showing now. So no embryo is formed. So now it is, she's showing this, a diploid sperm. So it could be 46xx or 46xy. Diploid. It's only one sperm. Oh, this is sperm with a bulky head. I've formed with sperms. Only one sperm. Yeah. So this sperm has no two tails, only one tail. That's also an abnormality. No good, they always are abnormal. We don't bother much about the abnormal sperms, we bother about the count of the spermatozoa. Right? 46xx. Bigger, yeah. So this 46xx is, what is the chromosomal constituent of the ovum? It is 0. Yeah. So that gives rise to 46. So this is how we say the entire chromosomal constitution contributed by the sperm. So it is paternal origin, theory of androgenesis. Yeah, thank you. This is clear now? See, blighted ovum plus two sperms. You have written there 23x and 23x. It could be 23x, 23, but only 10 to 12% the chromosomal constituency of this Hydatidiform mole would be 46xy. Otherwise, most of them are 46xx. Okay. So, we have just come to the end of this lecture. I told you should be able to define Hydatidiform mole. Then say what are the types of Hydatidiform mole, what is the meaning of gestational trophoblastic disease, and what is the pathogenesis of Hydatidiform mole. Okay, grossly, how do you expect? Just imagine how will be the uterus. We don't get a hysterectomy specimen. Okay, so uterus would be bulky only on radiology and only on palpation. So what we get is what Dr. Prema and curate and send us. So they curate everything, the entire evacuation of the molar tissue, and then they send it to us. Most often it is so diagnostic. They may not be willing to send us entire, but we insist that we need the specimen. We say it is a museum for the purpose of museum and for people like for student teaching aid. So we say please send us everything. Don't just discard. So bulky uterus and no fetal parts, but uterus would be filled with such nice, delicate, grape-like structures. It will not be so clean. You know, I have made my technician dissect all the blood clots and all that. It's only to make it look very clean, washing continuously, removing all the blood, it's appearing clean. Otherwise, it's a mass of hemorrhagic tissue, not a hemorrhage, but blood clot. So they measure structures, cystic structures, translucent, measuring 1 to 30 centimeters in diameter. Usually they are small, 1 to 2 centimeters, filled with clear fluid and joined by thin branching stalks resembling bunch of grapes. So microscopy, shall we quickly draw a diagram? You will write or shall I write? Easy as you say you write. No? Let me write. Anybody who can help me in writing? Yes? Why nobody volunteers? They are there to help you, there to tell you what you need to write. Can I see some hands going up for volunteering? No? See, no enthusiasm. You should have said, yeah, both hands go up. Nobody interested? Your cluster? We take your cluster, right? X cluster. Okay. Shall we take him to draw the diagram? I want another person. Come, I will come. I want another to accompany Arvind. Just select somebody from the cell. No. Who should write normal? Arvind normal. I thought it is theory of androgenesis and all contributed from the sperm, so normal would be written by Arvind. Okay, then get light in the open. Oh, that's not, yeah. Arvind, you're supposed to write normal. Come this side, mega. Put a division there. Yeah. So Arvind is writing a normal trophoblast. You are writing an enlarged villus, one villus. Right. Can I show you the picture here? I showed you a picture. Very good. Yeah, that's how it is. I'm just taking color. No, yeah, this is fine. This is fine. They're all villi. Okay, small. So if you have to see what he has written. So if these are normal villi, what should she write? Enlarged villi. Is this enlarged? Enlarged? No, if friends are not agreeing, just rub it off. So write enlarged villi. Any matches? Enlarged villi. Are they large? Yes, are they large?
Yes, sir.
Okay, please contribute, yeah?
Yes,
very good, excellent. Now, what is a lining? What second point what we should write? Tell me. Yeah? Trophoblastic proliferation. Fine, excellent. Trophoblastic proliferation. Take this. So trophoblast. So there lie cuboidal cells. These are cytotrophoblast. They're supposed to secrete pure cytoplasm. I'll make you write sometime later. Listen. Cytotrophoblast has clear cytoplasm. Yes, round nucleus, take blue color. Arvind, take blue color. This is cuboidal, see how the technique does. Cuboidal, got it? Yeah. So what has to be done here? Normally when you look at villi, if there is increased trophoblast, they're just there bipolar, only at the ends of the chorionic villi. There could be slight prominence, that's all, a normal trophoblast. Whereas here, there is trophoblastic proliferation. So you see plenty of trophoblasts. Cells which are like this, including the cytotrophoblast, syncytiotrophoblasts, right? Syncytiotrophoblasts, syncytium, all the cells fuse together. Cytoplasm comes together. So when many cells fuse with cytoplasm coming together, how many nuclei do you see in the cell? Many nuclei. So that is a syncytiotrophoblast. So being cytoplasm, it is irregular and has plenty of nuclei, which look really dark. So it is not don't mistake it for malignant cell. So lot of, write more trophoblastic tissue. I'll make you write this diagram. It's a very important question in the exam also. In our practical exercise, a major slide. So this is trophoblastic proliferation. Okay. So we have just come to the last point. What is that? What is another feature to make a diagnosis of? Yes? Stroma. So what should be the stroma? It is vascular here. So plenty of vessels and blood. What are these vessels lined by? Blood vessels? Endothelial cells. So one or two nuclei would be shown and then RBCs. So lot of blood vessels here with the stroma. What cells have you seen in this? Have you heard? Remember the Hofbauer cells? Anatomy, histology? No? No? Hofbauer cells, placental cells within the villi. Okay. So here, no tissue, no vascularity. So it would be just clear or myxomatous change. No vascularity. So this is the degenerated stroma. Can you label the parts now? So degenerated stroma. So write more syncytiotrophoblasts. I think even you represent one or two syncytiotrophoblasts there. And when you write syncytiotrophoblasts, make this nuclei dark and let them be irregular. Okay, just write syncytiotrophoblasts there. Are there giant cells normally seen in the body? Syncytiotrophoblasts? Yes. Any of the giant cells that are normally present in the body? Very good. Megakaryocyte? Osteoclasts. The giant cells which are physiological giant cells which are normally present in the body. Clear? The microscopy and gross? Yes? If a slide is given to you, can you identify this on your own? Yes, say yes. It's like what the mind does not know. So if your mind knows, you can identify what you are supposed to identify. No, it will identify. Otherwise, no. No, you will never. Because you have seen a bunch of grapes and you have eaten grapes and you have taught about G for grapes from the beginning. You could identify a bunch of grapes, right? Then you could apply that simile, the knowledge. So compare it with a pathological disease in the body that look like that. Yes? So big round of applause to them. They presented nicely. No energy to clap also. as therapy, clapping, how it helps. Have you read about it? Then go ahead and read how clapping also is helpful for to keep a body healthy.